my honor to present the panel and then ask a question. First, Bill Woods. Bill, you want to nod or otherwise move? So they Bill Woods is the owner, president of a nonprofit called AIR Inc., which does a lot of nonprofit civic research. And then Cynthia Smith. Cynthia, say a little bit about the organization you work with. I know you're not here representing that organization, you're here on your own, but I want people to know.
Good evening. My name is Cynthia Smith, and I'm the director for the Women and Infant Vitality Network, which is Hamilton County's infant mortality reduction program. We have a public health issue in our community of babies dying before they reach their first birthday. I'm here to hear about some preventive health care so that we can have healthier women, healthier girls, healthier babies.
Dr. Ed Herzig, who has been a member of the forum, I think from its inception, and is a very accomplished local physician. And then a professional civic volunteer, Sarah Gideons. Sarah has also been on the steering committee of the forum for quite a while now and has done some excellent work. And she and Mrs. Herzig have done, Andy or Andrea Herzig, have done a wonderful job with tonight's program. If you could just give them a quick hand. I suppose I'm the small business representative that is going to moderate this panel. But first, as the vice chair of the forum, I just want to say a couple of things about legislation and my personal feelings about health care because of the perspective I have. One, I'd like to speak for two people who are not here. One is my sister Susan, who we lost in January of '09 at the age of 50. Susan lost her health insurance when, through the wonders of divorce, her husband at the time thought that would be a great way to win some sort of victory. But the problem with Sue is that she was uninsurable. She had rheumatoid arthritis. She later was diagnosed with a lupus type injury that turned out not to be lupus. She had a boatload of problems. She could not get a job, raised two children, which is, as you all know, quite a job. And she used to go to the emergency room as her primary care source of health. One of the litmus tests I have for legislation is, will we cover people like Sue, and we've heard a lot about pre-existing conditions, but with assurance that they can afford, and will we help businesses who choose to hire someone like Sue, will we help them and they being able to pay the premiums? Because it's not just coverage. I can get you coverage, but you won't be able to afford it. The second litmus test I have, is because of only because of my personal experience, you have many more, we're going to hear about some of them, is my Uncle Don. He worked for years and years and years on the road as a salesman. The last 15 of those years, he had multiple sclerosis. He hired people who would drive him and then people who would carry him, put him in his wheelchair so he could wheel in and get an order written. Don got off the road after 15 years with MS because he really couldn't do it anymore, and almost immediately went to a nursing home and had to divorce his wife. So he wouldn't, the money, the assets of the children, this is a man who did very, very well, very, very well in providing for his family throughout all that time and leaving them with some money. But he loved them so much that he wound up in a very marginal nursing home and had to give up everything. And after a period of time, he did die because of organ failure, not an MS, but organ failure. The question is, as you get older and have that kind of serious condition, are these plans going to make any provision, or is it just a hard luck story? Just another hard luck story. Well, for years before I knew Sue was going to die that way and Don was going to wind up that way, I didn't think the system was right, because all of us are one car crash away from either being uninsurable or from being given a wonderful choice when your child is in that crash. Do I bankrupt the rest of the family in order to pay for the insurance that child had, and now with astronomical medical bills? What do I do? So anyway, those are some of the yardsticks with which I personally look at the issue. But the small business question, which is hard to divorce from the people who I employ and work for me, and we have a very good policy, and I have gotten a call that says, oh, your rates are going to go up 25%. And I said, what? They said, Dave, you're lucky. You know how many 40%ers I've talked to today? How many 30%ers? I said, but can you tell me why? They come back and they say, great news, I'm able to get 5% of that knocked off by doing A, B, and C. And I have good people that know I have other options to go to. I mean, they're not crooks. It's just how the system works. And one year I was told, well, Dave, your daughter works in your business. And she was much younger. And she had jaw surgery. So this caused your rates to jump. It was part of an orthodontic deal when she was a kid. So we have to jump your premiums up. I said, but that's not even a condition that's recurring. It's a one-time thing. Now, you know, I could have switched companies, but then what happens when you switch companies to get a better price? Everybody with a pre-existing condition may not be covered.
That's incorrect.
That's incorrect.
That is correct.
That's incorrect.
Hold your comments.
All right, well, I'm sorry that I said something. Well, and maybe I need something to learn, but I'll tell you that's what my broker told me, so maybe my broker. That may be, but Steve, let me ask the two of you this. What assurance in any of the bills do we have that people with pre-existing conditions are going to be covered at an affordable rate, whether they get their coverage through a public option or through an insurance, their small business bill?